My name is Tina Dalrymple. I am the Director of Clinical IT, so all of the clinical pieces of Epic. And then I have Kathy Vogler here with me, who is the one of the analysts that helped build MyChart, along with many other pieces of our Epic electronic health records. So we were asked today to kind of share some information regarding MyChart, which is your access to your health information. So what is MyChart? Like I said, it is the ability for you guys to kind of manage your care, see what's happening with your care, see results, et cetera, and we'll get into more detail as we progress through the slides. If you have been a patient with Memorial, you probably had access to this information, but it looks a little bit different with Meditech, which was our hospital-based EMR, and it was called our patient portal. And then if you had a patient portal through your ambulatory office, that would have been through Greenway. So you would have had two patient portals that you use to kind of help manage your care, see results, et cetera. So with the wonderful world of Epic, we have been able to eliminate the confusion that two patient portals happens, and we now have one. So with that being said, it means too that we have to register everybody for a new portal, and it's now called MyChart. So we'll kind of go through the steps of how to get access to your new MyChart account throughout the presentation. Okay, so just a little bit, kind of an overview of what MyChart is. This is much more robust than what you've seen in previous patient portals. There's just a lot more opportunity to allow our patients to be able to do things for themselves in their care, whether it's appointments or messaging providers and things like that, paying bills. So as you get access to MyChart and encourage your staff to sign up for MyChart, you'll see that it's got a lot more functionality than the things that you've seen before. So like I said, you know, it allows you to pay bills, look at your bills, schedule office visits, and then it can be accessed through a desktop, through a tablet, and an app on your phone, both Apple and Android. On the right, if you hit enter again, I think it'll pop up. There should be, it's kind of a enhanced PowerPoint, but you'll see like the app is very, just like all apps, they're wonderful, they're very user-friendly and easy to use and accessible anywhere. Next slide. There you go. There you go. So that's kind of what it looks like on your phone. And like I said, very easy, just kind of point and click what you want to look at, what you want to do, and it just takes you right there. Next slide. Okay, and then I'm going to kind of hand it off to Kathy. She's the expert with MyChart, and she'll kind of go through the rest of the slides for us.
So one thing I wanted to add to what Tina said is if you currently have a MyChart account at another facility, at Deaconess or a Bloomington Hospital or something like that, you can link your accounts together from one MyChart account. So that's something else to kind of be aware of. A lot of people said, oh, I think I have a MyChart account. So that's another way that you can link those two together. So you still have to get a MyChart Memorial account, but then once you get that, you can see other MyChart accounts you have, and then you can link the two together. So that kind of helps with your access to your care. So as Tina said, I'm going to kind of go through a few things. So one of the biggest things we get right away is MyChart activation. So if you want to go to the next slide, how do I get activated? What's the thing that I need to do to get on this amazing portal? So one of the things you need to do is when you go to your Memorial provider, whether that's your primary care provider or another provider here at Memorial, go to their office, you can just ask them to give you an activation code and sign you up. You will get an activation code either through email or text, however you want to do that, or they can print that out on your after visit summary, and you can take that home with you and sign up then. So you can either do it right there in the office or have the convenience of just doing it when you get home. So those are two ways. Those are the most popular ways, the easiest way. The next way would be just to go out to Memorial's website, which is mhhcc.org, and there is a MyChart link at the top, and there is a place where you can go in and you can sign up yourself. And I believe, yeah, if you want to go to the next slide. So once you get activated and you've got your activation code, you can go through the steps, and then you can sign up for MyChart. If you go to the next slide, there is, oh, it's going to pop up separate. Okay, it looks different. Yeah. Okay, so like this is what it's going to look like. You're going to create your password, put in your date of birth. So this would be from the website. So like if you're on Memorial's website, you would go here, you put in, you know, a password, date of birth, click submit. And then once you click submit, I think if you go to the next slide, it should pop up. There you go. So you can do your username, password, that kind of thing. And then next slide. So it's just like every other website. And then this is where you can decide how you want to receive notifications. So do you want to do those from email, text, both? You know, how do you want to do that? Put your mobile number in, and then next slide. And then you're going to click on accept here to accept the terms and conditions of use of MyChart. And then once you do that, you are in and you have an account. So the next thing I want to talk about is kind of, Tina mentioned some of the things that MyChart can do. So we're going to talk a little bit about scheduling. So if you go to the next slide, there's a few things that you can do on MyChart. You can request an appointment with your provider. You can do eCheck-In, which is basically, instead of going to the front desk and signing all the papers there, a lot of the clinics have it where you can do all this stuff electronically before you even enter the building. If you get everything filled out before you come, you don't even have to stop at the front desk, which kind of takes me to the Hello Patient. There are also questionnaires. So like if you have paperwork you fill out, that is like of course we're in the age of COVID right now. So there's all those COVID questionnaires, you know, have you had a fever, you know, chills, those things, cough. Those questionnaires can all be filled out through this eCheck-In process on your MyChart account. And then those questionnaires go automatically to your chart. So that's really nice. So the other thing is Hello Patient, which we're going to talk a little bit about, but that's basically if anybody's ever done like a Walmart pickup where you show up in your spot and it says, you're here, tell us what spot you're in. It's kind of what Hello Patient does. It follows you to the clinic and it says, hey, you're here. Looks like you filled out all your stuff. You can just have a seat and we'll call you when we're ready. Or, hey, could you stop by the front desk? There's a couple things we need you to do. So it's really nice to kind of prompt the patients as to what they need to do when they show up at the clinic. You can reschedule an existing appointment. You can cancel your appointment. And then you also will get appointment reminders on MyChart as well. So if you want to go to the next slide, this is kind of what an appointment request would look like in your MyChart account. You would go in. You would put what it's for, the preferred dates, times, and then you could just click send request. That goes immediately to the scheduling desk, and then they will call you to set up an appointment. So that's a really nice feature as well. Next slide shows eCheck-In. So this is just a quick screenshot of what eCheck-In starts to look like, and you'll see the banner of tabs across the top, the signed documents, payments, meds. You can sign everything electronically on the website there on MyChart, so that's really nice. And then you can also start the eCheck-In, and if you get interrupted, you can say finish later, and maybe you don't get finished and you have to finish in the clinic. So this is just an option to show you kind of what's available there. You can also look at your meds and allergies and update those here as well, so that when you go in, those are already updated. So if you go to the next slide, this is what I was talking about, Hello Patient. So this is kind of what it looks like on your phone. I tested this out. It was pretty cool with some test patients and drove to one of the clinics, and it popped up, and it was really neat to see, you know, how that was going to work for our patients and give them that little bit of extra help that they need when they get to the clinic as to know what to do, and also to save everyone a little time. It saves the front desk time, and it also saves our patients obviously a lot of time. They can do that in the convenience of their own home instead of having to go to the clinic and spend all that extra time signing and filling out papers. The next just shows you a quick what it looks like when you want to cancel an appointment. So you can see here, I can just click cancel and then confirm my cancellation. That actually will send a message to the clinic, and it will also take you off the schedule immediately. So if you need another appointment, you can also reschedule a current appointment as well. So you can see that there where it says, you know, reschedule appointment, and then it will take you to an area where you can reschedule that. So that also saves a little time with calling the office and having to click 1, 2, 3, 4 and wait for a prompt for a voicemail and then have somebody call you back at the end of the day. So this will hopefully help some of those lags in time that we have with scheduling and clinics being busy. The next tab is something I really like and have been really excited about for our patients, is the test results being released immediately upon resulting. The provider doesn't even have to really look at them. It just, as soon as they're resulted out in the lab or radiology, those get pushed immediately to the patient. So if you're waiting to see what your, you know, hemoglobin A1C is, if you have diabetes or something like that, and you want to see those results, or, you know, something else, those get pushed out immediately, and you get a notification on your phone or your email saying, hey, you have new results, log into your MyChart account to check those out. It's not just labs, so that could be, you know, x-rays, you know, anything in radiology, mammograms. You're also going to get your notes from your provider's offices. You're also going to get like surgery reports and things like that. So this is a lot more robust as far as the type of information that you're going to be getting in your MyChart account versus what we had before. So we're really excited to be able to offer that for our patients. The next thing is messaging. So you're also able to click on your message center in MyChart and send a question to different areas. You can send a non-urgent medical question. That's going to go to your provider's nurse, and then they're going to be able to help answer those questions right here on the screen. You're going to get kind of like just a quick email back and forth, but it's all encrypted and safe and secure so that you can feel good about sending, you know, personal information in as well. I believe you can also even like send a picture of something, those type things. There's also customer service questions, which could just mean maybe you're having trouble with MyChart. There's a technical issue, it's not responding, or you can't get logged in, things like that. That goes to our help desk. And then there's also questions that you can ask regarding billing, if you have questions about a statement or things like that. And speaking of statement, I did have some people ask me this week about paperless billing. You are automatically signed up for paperless billing when you sign up for MyChart, and some patients were wondering why they weren't getting a bill. So anytime they want to know anything, they just go up to that little menu in the top left. There's a search bar. You search for paperless billing, and you can turn that on and off. So you have a lot of responsibility for your own care here, which is nice. You can play around in here, and you really can't mess anything up. You just, you know, click on different features and, you know, see what all is available for you in that menu. So the next thing is questionnaires. So we talked a little bit earlier about questionnaires, but this is just a, oh, I guess it does show you those on there. Sorry about that. My PowerPoint doesn't do all those magical things, but that just shows you how those different questions look. Questionnaires, this just shows you a little bit about how that would look. So, you know, how are you feeling? The communicable disease screening, you know, do you have any of the following symptoms? You know, contact with anyone with COVID, your history. So if you were like a patient coming into the clinic for the very first time, they could send you a questionnaire, even though you've never been there before. They could send those things to you ahead of time and have you fill some of those things out online. So this is just kind of what the questionnaire would look like from that standpoint. And again, those are submitted, and then those are just sent right to your chart. So the next thing we're going to talk about is video visits. So this is also something that, of course, with COVID entering our lives last year, we had a lot of new features that we had to come up with quickly for telemedicine for our patients. And now that we have Epic and MyChart, this makes it even easier for both the patient and the provider to have access to the patients virtually. So the next screen will show you just kind of what that looks like. You can do it right from your phone. As Tina said, you can do it from a tablet. You can do it from your laptop, whatever you have, iPad. But this is just sort of what it looks like. You can get on here and you can see that Doug has a video visit scheduled. He logs into this website and then he gets a reminder that says, hey, click on your visit to begin. The provider on the other side is going to see basically the same thing on their side. Hey, Doug is ready for his appointment. They click from their end and then the videos will sync. I think the next slide shows you, this is from, then it says begin visit at the bottom. And then you're going to get the next slide showing you basically a hardware test. Is your camera on? Is your microphone on? Do you want to test your speaker? Just make sure, and it'll kind of go through this little test and the green lines will go through and say like, okay, great. And then you can join the call. So you're going to click join call. And then you can see that the patient is at the bottom and the provider's at the top, and you can see where they can talk to each other just as if they were in person, which is really, really nice. We've had a lot of success with this in our clinic. So the next thing we're going to talk about is proxy access. So this gets a little confusing, so we're going to try to go through this quickly but efficiently. So patients have access, obviously, to their MyChart account. You can go to the next slide, too. They have access to their MyChart account, as Tina said, to get access to all their information. You're responsible for all your information. So starting at age 14, patients can have their own MyChart account. That is not a Memorial rule, that's a law. I know some people are like 14, but patients can actually seek medical treatment now at age 14 without a parent consent. So with that being said, patients have to be given the permission to have their own MyChart account at age 14. So a patient can get access also to another patient's information through proxy access. So there's kind of two things here. There's an age thing and then there's a proxy access. So like for instance, if you had elderly parents and you were maybe power of attorney or you're just taking care of them or you're their guardian, you can have access to all of their records and help keep track of their medicines and things like that. Messages, you can talk back and forth with their provider. Hey, this is, Susie's daughter, and I'm having concerns about my mom falling, whatever, that kind of thing. So that's really nice as well. If you go to the next slide, this kind of explains the teen access a little bit more. Go up one more, back one more. There you go. So parents and guardians can have full access to their child's information, basically until they're 18, but with permission from the child. So when a child turns 14, their MyChart account, if they have a parent, so like if Tina was my mom and she's got access, then it automatically is going to cut her off at age 14. If the child is okay with the parent still having access from then until they turn 18, maybe they need help or they're not, mentally stable enough to do their own care, then I would have to sign a form along with my mom saying that I give her permission to do that. So there is a form. It is not electronic at this point, so that would be something that you would have to come in and fill out for that access to continue. Or if the child goes ahead and gets their own account, at some point the child can just go into 14 or older, can just go into their MyChart account and they can just give their parent access without the form. Basically, they're just doing it on their own because they already have an account, and later on they might say, well, I kind of do want mom to see. So they can limit that access as well. They can just say, well, I only want my mom to see my results. I don't want her to see everything. I don't want her to see the messages back and forth to the doctor. Like there's limits there. So those are things that that we have put in place. So that's kind of what this addresses a little bit. So I know that a lot of people have questions about the age 14, and that usually shocks people when they see that, but that is the law. So we're just kind of going along with that, making sure that patients have access to their own care according to those legal terms. So the next one just kind of shows granting proxy access. So again, if like for instance, I have a MyChart account and my husband has a MyChart account and we want to make sure that each other has access if something happens, I can actually just go to my MyChart account and I can click on Friends and Family Access, and I can actually go in and choose who I want, you know, to be that person. So if you go to the next slide, it kind of shows you, you can invite someone. So you can see like who I can see and who can see me, basically, and then I can invite someone. Now, for instance, like let's just say in a divorce situation, you may not want your husband or your wife to have those access anymore. So you can click the revoke button and you have the right to, you know, not let them have that access. This is your medical record chart. This is your information, so you have a right to who sees it and who doesn't. So this gives you full responsibility, you know, to handle your own care here, which is the whole point. And then the last slide basically is just showing you what this looks like, MyChart from Memorial Hospital's website. This just talks about how it is your record and it's available on your terms, and kind of shows you where to sign in. And if you're a new user, then you can click the sign up now if you have that activation code, and then you can enter that there as well. The MyChart FAQ on the left has some great questions that we felt like were things that most people would want to know. And so we've added those in as well as an added benefit for people to be able to get the information that they need.